For a patient whose cancer spread beyond the testis to an area like the lung or the lymph nodes, chemotherapy is the standard of care. Once the chemotherapy is complete, it's often the case the cancer has not disappeared altogether, and therefore that cancer needs to be addressed. And what we tend to do under those circumstances is we tend to, if the area is large enough, would cut it out.
It may be suggested that you have a procedure or an operation called a retroperitoneal lymph node dissection.
This is a major operation, and it is considered in patients where they have had spread of their cancer or suspected spread of the cancer into lymph glands which are located towards the back of the abdominal cavity. Is, if you like, the third type of system that we have, from arteries, veins and the lymphatic system. It carries fluid from different parts of the body, excess fluid, back into the main blood flow. There are, if you like, way stations every now and then, and they are little nodes or nodules, and these are called the lymph nodes. They can trap germs if they're coming from a particular tissue that the lymphatic fluid has drained into from that organ, or they can also trap cancer cells.
So for some reason, the cancer decides to spread initially via the lymph system and then subsequently via the bloodstream.
RPLND involves a big incision from the bottom of the chest.
Through this incision, lymph nodes and any residual tissue that could be scar tissue or cancerous will be removed.
I went into hospital on the Saturday, whereby I had surgery that lasted a couple of hours, and I came out of surgery and was in intensive care for a couple of hours, and eventually moved on to the ward, whereby my family and friends were able to visit me, and I spent about a week in hospital.
There are risks of the immediate aftermath in the aftercare period, which is that there could be bleeding from it, there could be scar tissue forming with the intestines, and that could cause discomfort and pain in the future. There could also be problems with the wound itself and its healing, slow healing and so forth, but usually most of the patients are fit and well, so they recover very well.
After the surgery and after a couple of weeks recovery, I had a further CT scan, which my oncologist and actually the surgeon at the time confirmed that it had been a success and they'd taken everything out that was deemed to be unsafe. So it was really good news. And I guess after that, then my oncologist told me that there was no need for further chemotherapy, no need for further treatment, and I was now under surveillance effectively, that I would be seeing him every couple of months and having further CT scans and blood tests and those things. So that came as a big relief.